All this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. This is our third talk for today. So welcome everyone. Let's do our quick chit chat. DDS, welcome. You are actually the first today. Loretta, hello. Christy, hello. And Lorene Kirby, hello from Chicago, and back to everyone as well. So I think that this discussion that we just have, two in a row. Yes, you were first again today. Jim, hello. Jim Meres is here. Jim, did your friend Mike join us that day? Doug, fifth. And then we have lots of folks. So welcome to everyone. So tell me, how did you like the discussion? I was totally thrilled, although the study size is small, the sample size is small, but I was very much thrilled with the data that we saw and how the immune system responded after a person had been infected and how the second dose actually did not make any sense. Oh, I should not say sense, did not make much difference because body was already reacting. I hope that that mechanism is clear, that why the second dose did not make much difference. Interestingly, I had been talking about the same mechanisms for some time, and here is a study that kind of shows the data for it. And this is thanks to a cool bean who tweeted that at me. Dani says, I had the J&J vaccine on Good Friday, and now I'm scared of all the bad news about it. So actually, this is so interesting, Dani, because my wife had the vaccine on the same day, and today she was saying, I have severe headache that just keeps coming and going. And here is the deal. Look, there is no mechanism to go to and say, this may be clotting, and let's just very quickly get ahead of this. There is no mechanism except me giving her medicines and say, take this. There is nothing. And she has been complaining about headache now since yesterday. And she had J&J as well. So I don't want to scare you further. I think, so Good Friday to now, what is the time? Almost one week. So you are basically in the clear. Usually it starts 3, 4, 5 days, and then within 3, 4, 5 to 17 days window. But if it hasn't started by now, any of the bad side effects, then you should be okay. So don't be worried. What I did was, for my wife, I am giving her some blood thinners that I could get. Jim says yes, and he's doing better. Excellent, good to know. Rima says it reinforced what you said. Yes, thank you. So Lana says, my cousin continues to have headaches after taking a second dose 10 days ago. So here is an important thing, which is, again, data oriented. It's not me saying it is okay or not. What is seen is that if the clotting type problem does not occur after the first dose, then it does not occur after the second dose. From a mechanism point of view, that makes sense. Because if the body is going to make antibodies against platelet factor 4, then it is going to make it as soon as the first dose comes in, and the body's antibody response becomes ready. And it is going to be really difficult to say that, hey, the first time when we poked the immune system, it did not create the antibodies, but the second time it went mad and made them. So I think second dose and after is better. So Margaret is saying, is she getting better? So yes, Margaret, she has been complaining about it, off and on headache. She says it is not the kind of headache she normally gets. And so I've been giving her medicines and she becomes okay. And then she says it again. What she doesn't know is that I'm keeping an eye on her activity and trying to see if she is alert and fine, and she is. But it kind of scares me. And so when I was going through this by myself, I'm still kind of figuring out those folks who were yelling and screaming and cursing me that, why are you talking about this? This happens in rare number of people. It doesn't even matter. Here we have a patient at home, which I feel that I should take care of. There have been 2 cool beans who have commented about the symptoms that were related to clotting. One actually said I developed clotting. So why not be ready about it? Yes. I mean, at the same time, what is interesting for me is that because our authorities have not acknowledged it, and there is just so much pushback that don't you say that this is the vaccine. Even this morning, somebody had sent me a long letter saying, how dare you say that this is the vaccine and blah. If we just acknowledge that this can happen, then we would be better ready. For her, the only letter she has after the vaccine is, if you become severely ill, call 911. So, Karen, hi, Dr. Bean, your information is wonderful. Thank you very much. I got the J&J. You'll be fine. J&J is actually a good one. The thing is that this is adenovirus based as well. So it has a similar risk like AstraZeneca. So, Jen, question. Vaccines are still in EUA stage. Is there data collection taking place over the next couple of years to compare vaccinated versus non-vaccinated for long-term effects such as neuro disorders, strokes? I am sure that they would be doing it. I'm sure that they would be doing it. So Doug says, question, has long haul occurred in anyone who treated COVID-19 with ivermectin? If so, is the incidence lower? So as you know, in my patients, I don't have long haulers. So I do not have a direct experience of, or I should back up. There were two patients who became long haulers. They both recovered with the pulse therapy with the steroids. Other than that, I don't have long haulers, and I use ivermectin. Thank you very much, Sepa Steve. Yes, hit the, as France says, and I think you say that as well, and others to paw the like button. And my own state, so I had the vaccine 2 days ago. Yesterday, I was a little tired. Today, during the middle of the day, I felt a little slow. But as you can tell, I'm actually fine. There is no pain. There is nothing else. So generally, it went fine. So Zia says, are we having a Zoom tonight? So Zia, I wanted to spend some time with my family. I just want to make sure that I'm around. So today we will skip on Zoom. I have a question though, and that is that Injan had asked about Qigong that, hey, is there a different time that is suitable for cool beans? So if you hear this and if you have an opinion, please put a comment, not in the live talk, afterwards under the video, so I can read them, and then we can talk with Injan to say what is. He's in Ireland, so let's figure out a time that may be suitable for him as well. So I hope it is okay. So two things actually. Thank you very much for Zia for bringing it up. One, we will skip Zoom if you're okay this week. Plus, I will skip tomorrow, and I would take the day off and just be with my family if that is okay. And so then we'll go back to a regular interval. Maybe we'll continue the weekends to be both days off, but if I can get tomorrow off, that would be great. So Sarah says, can people who get the vaccine transmit the illness to others if they got sick? So if somebody gets sick, they would transmit it. Vaccine is not a gate to say the virus cannot come in and the virus cannot go out. The thing that we have discussed many times is this: when the virus arrives in our mouth, let's say, or nose, in theory, after the vaccine or after the infection, we have developed immunoglobulin A that is lining our mucous membranes and is protecting it. And they have seen that this happens more with the actual infection compared to vaccines. There are now nasal and oral vaccines that may do more IgAs. Now, when the immunoglobulin A is present in the mucous membranes and the virus arrives in the and joins the mucous membranes area, that immunoglobulin can bind with it. And that would then try to kind of make it virus heavy enough and stuck there that it cannot be shed. And even when it is shed, it is now going to go with the IgA attached to it, and it would be less effective. Then secondly, the immune system would respond within a 24 hours. So the virus only has 24 hours window to do a lot of harm in this area, increase the load enough that it can be shed. So as you saw that vaccines like Pfizer had given this data that about 70% or more reduction in transmission. 100% reduction, I don't think would occur. Denise says, I need a year off after the day I had today. Enjoy your weekend, doc. You need a year off? Oh, wow. What happened, Denise? Uh, So Art Patron Forever says long haulers may have virus resident in gut biome. And we have done this discussion that number one, virus does shed in the gut or from the gut for about 59 days after the infection. Number two, there has been some studies that say that virus may be present in the gut for a longer period of time. But the study that saw this, they said that presence of the virus continued to refine immune system's response and actually improve the immune system. So now maybe it is improving it or maybe not. So James Crook says, Dr. Bean, take the time you and your family need. You're such a light in the dark. Thank you very much. Ellen says, AstraZeneca confirmed causing autoimmune via TT, even if no acute adverse effects after vaccination, long-term consequences of autoimmunity. So first of all, confirmed causing autoimmune via TT, is that in new news or the same discussion that we've been doing? And then if no acute adverse effect after vaccination, long-term consequence. So the thing is this, many people on my video of getting vaccination have sent me either comments or texts or emails that in 5 years you will be doomed, and some said you're dead and you'll be this and you would be that. Who has seen 5 years? Who can claim what would happen in, I don't even know if I'll live tomorrow or in 5 years, or I don't know what other diseases will I get, or I don't know how good a health I would have. How can somebody who is saying that I do not know about vaccine is also saying that 5 years later I'll be sick from it? So don't know. We do not know. And so if we do not know means that Mubin is going to be doomed, then we do not know also can mean that Mubin may be okay as well. So I'm not too much worried about this from a mechanism point of view. These vaccines are not new, number one. Number two, the mechanism of a vaccine is not new to us. We get infected all the time. It is a similar mechanism. So I'm not worried, but we'll see. Skyfrog says, okay, so this is a side discussion. Muhammad Imtiaz says, vaccinated for Pfizer vaccine in January for both doses, but got infected with COVID on 3rd April. So January, Pfizer, 3rd April. Mild fever, sore throat, took ivermectin. Are vaccine escape variants available? Are vaccine escape variant available? I don't know what you mean by the escape variant available, but vaccines are not 100%. So having a vaccine and then having an infection is possible. The most important thing with the vaccines is that they are very efficacious against hospitalization and death, but one can still get infected. So Denise, what happened? I'm still curious. Emily says, I've had my first dose of Pfizer, never had antibodies from COVID, acute infection, first dose of Pfizer, never had antibodies from COVID. Do you still recommend getting the second dose? So Emily, with the data that you saw, and I would show you that data again, it actually simply says it doesn't matter. So that means whatever makes you feel comfortable. So here, if you see this one, this is the second dose of the vaccine in a previously COVID infected patient. This is the 14 days after the first dose of the vaccine in a previously COVID infected patient. So if you see, they have similar results. So if you took the dose, doesn't matter, it would still be fine. Meaning, I think there is no harm in it, but body is not going to be bothered much by that. Denise says, I feel like I broke a house of mirrors. What happened, Denise? I'm so sorry. Um, I'm trying to see what Denise says. I don't even know where to begin. Lots of prayers. And of course, you can see I'm concerned. I hope you are okay and you stay okay. Arun says, so probiotics must be given to avoid GAT problems. Am I right? I think that many of the long haulers have responded very well to probiotics. So probiotics may not be a bad idea. So Skyfrog says, what is the best research sites? So of course, CDC and WHO are not the best for this, anyways. They have lost not only credibility, they are harming. So yes, Lancet, JAMA, NEJM or NEJM, British Medical Journal, and so on. These common ones. France says prebiotic too. Yes. Denise says, thanks, Doc. I'll be all right. Please let us know. We have become a family, Denise. So please, if you need something, please reach out. We are here. We are a group of cool beans, and you're part of it. I hope I didn't say anything or someone in the group did not do something that is causing you to leave. But we are here if we can be of any help. William Goff says, thank you for everything you do for us all. Sometimes listening to your videos is the only thing that gives me any hope at all that things will get better. You're appreciated more than you know. Thank you very much, William. And I am appreciative of your support here. Plus, please praying that you become okay and recover fast as well. Simple Steve says, question, the AstraZeneca vaccine appears to cause people to develop antibodies that target a protein called platelet factor 4, which spurs platelets into action and activates a clotting cascade. Thoughts? So yes, we talked about this a few days ago. So my discussion was AstraZeneca causes blood clots, German research. In that, I discussed this exact mechanism. And the mechanism is same thing as you just said, that what happens is that when AstraZeneca, and I think it is more than just the AstraZeneca, adenovirus-based vaccines, that includes Johnson & Johnson. When these vaccines are given in some people, not in all, if it was happening in all, then everybody would have the clotting issues. It is just like allergies. Some people respond to allergens with allergies, others don't. Peanut allergy, for example. So just the same way, when this is given to some people, they respond by, number one, creating antibodies for SARS-CoV-2. Number two, also creating antibodies that are against the platelet factor 4. And when that factor 4 is combined with the antibody is combined with the factor 4 on the platelet surface, the platelet goes under attack. When that attack starts occurring, platelet actually becomes activated as well. Active platelets start aggregating and make thrombi. The thrombus has its own negative effect of causing ischemia to the areas where the thrombus is blocking blood supply to. And the second is that consumes the platelets, and now thrombocytopenia occurs. The reduction in thrombus level, the platelet level occurs, which causes then absence of platelets where the actual thrombi are needed, and our body needs to make small microscopic thrombi all the time. We develop microscopic punctures in our blood vessels all the time, and when they are not present, then the bleeding starts occurring as well. So this is thrombotic thrombocytopenia. It is kind of a oxymoronic thing. It's kind of reverse paradoxical thing that thrombotic means thrombosis is happening, and thrombocytopenia means the thrombocytes or platelets are less. But this is a common phenomena that can be observed in ICU bound patients as well that have disseminated intravascular coagulation. They have a similar mechanism as well. So unfortunate, but it does happen in some people. Somebody was challenging me today, and probably correct to some extent, that this is not the vaccine, it is just some association. So don't say it caused, say it is associated, fine, whatever are the word that we want to use. But I still want people to be careful about it and be careful for how to take care of themselves in this situation. Just like I am worried about my wife and her headache. Cher says, question, can you explain factor 4 laden? Is it a risk to get vaccine or factor 5 laden? I don't think so. I don't think so. So far, this is the only one that has come up to be a risk, the hit kind of a problem. Mohammed Zubair says, Dr. Bean, please talk about the blood clot. I just talked about it, and I did a video a few days ago. That video's title is AstraZeneca Causes Blood Clots, German Research. Please watch that video. Samina says, after first dose of AstraZeneca and scheduled on 14 April, my brother is COVID positive. What to do for the second dose? Take second dose. As you can say, once a person becomes positive with COVID, they have the largest dose they can have. So these vaccines would really, these are like a drop in the bucket. But still, just take the second dose. That completes the vaccine. So Ken says, heard that Dr. Laurie analyzed WHO data that they base their ivermectin recommendation on. I have actually reached out to her to say that when can they come in. They are preparing for an international conference as well. I think she's busy with that, but I would have her, if possible, soon with us. So Danazir Etizol says, Dominican Republic are seeing cases post-vaccine thrombosis, not only from AstraZeneca. I'm rotating in internal med in one of the hospitals in Dominican Republic. The only vaccines available are Sinovac and AZ. So possible that with the Sinovac, this may be happening too. So without data, I cannot say it. But it is possible that it can be happening with other as well. So Janet says, high power 5 for Denise. Yes. Yes. Denise, simple garden only if the message has happy ending with a certain happy ending with a certain masseuse. Okay, so Gems. Dr. Bean, massage. Oh, so that was massage. Okay. Dr. Bean, do you have any insights about the CV crisis 4 months after the start of vaccine? What have you gained insight from a public health policy standpoint? Have you any insight about the CV crisis, start of the vaccines? So, Gems, I am still not sure that, and many people have been saying this, they may be right. I don't think so. And that is that somehow vaccines are triggering increase in cases. That is not the case. And important cases that would be in front of us are going to be Israel. Somebody was saying that there's another country which has a similar vaccine level like Israel, but their cases are not yet controlled. And I looked at that this morning. So if I go here, I believe it was Chile. So if I go here, and please forgive me if I'm not pronouncing it correctly. My pronunciations are all over the place. So let's see. Here, Chile, if you see here, they say that, hey, Chile has a very high vaccination rate, and that is correct. If you look at Israel, one dose is 58%. Chile has one dose 38%. So 38% is not good enough to be able to reach near herd immunity and slow down things. If you look at two doses, then it is only 23%. So that is not sufficient. Israel, one dose 58%, two doses 54%. So that is nearing more than 50%, and then they had some other infections, earlier infections as well. So I think it is not yet right to look at this number to say vaccine has failed. If you want to have this kind of a number, then see Israel doing very good with vaccine, UK is doing very good with vaccine. So that should be seen first. And I'm seeing lots of super chats, so thank you very much. Fishtail, thank you. I have one more fish. So Karen, thank you very much. So Phil Lee says, question, would GAT refining of immunity explain why post-appendectomy patients have reduced immunity? No, it will not. The GAT based refinement is the following. This is what that study thought is happening. We still actually need some more data to confirm that. Here is what they said. What happens is that when we have our B cells, so let's say this is a B cell, and this is a sleeping B cell, and it is kind of in a Zen state, and it is sleeping, and it is a memory cell. And not just this one, there are many other B cells that are sleeping. There are many other T cells that are sleeping as well. And they are all kind of ready to attack the virus. Now, when they're present in the lymph nodes, if you bring them more antigens, there are special cells that are called follicular dendritic cells. So they are different from dendritic cell that I talk about almost on daily basis. These are follicular. That means they only live in the lymph node. They do not go out. They do not come in. They just live there once they reach that home. Follicular dendritic cell catch the antigen from the lymph that is coming in. They bring that antigen to the sleeping and semi-active cells that are present in the lymph node, and they help them with something called affinity maturation. And again, it is not a mechanism that I made up compared to many doctors nowadays I'm hearing. So if you see affinity maturation, you would go to images. It's faster to see it over there. So you would see that there are many cells that do affinity maturation. So here, affinity maturation, this must be the follicular. See, this says FDC, follicular dendritic cell, and these are the other cells sitting here, and it is presenting them the antigen. So follicular dendritic cell helps with the affinity maturation. That means if there is a supply of the antigen, let's say coming from the gut, then these cells can continue to present the cell antigen to the sleeping cells or the cells present here. And in response to this, these cells continue to mature themselves to know how to better fit with the antigen and how to better respond and quickly kill the antigen. So they are resting here, but they are still becoming mature and mature. And this study had said that the benefit of the virus sitting in the gut is actually the follicular affinity maturation to be occurring, and it is a good thing. I do not know how much should we actually put our belief in this one, because there needs to be more studies. This is one of the studies. And thank you very much. There is another. So Renal, thank you. Your teaching have me taking on so much misinformation, specifically that the vax modifies DNA. Thank you very much. And that was the point of this, that we should be educated. I was thinking about it today. Somebody sent me a number of links this morning about a doctor who is also on YouTube, and said that this person is saying that the immunity is better with this and immunity is better with that. And I watched that video, and all that person was doing was he was just giving opinions. He was a medical pundit. And so he was just saying things, and there was no backing up. Or it became either, it became our responsibility to either just take him on the face value of it, or then go and do our own research. And I felt a little happy that I have always put the links out there. Then I bring us to the links and say, here is something that I'm going to discuss. Now, it is possible that when I discuss it wrong. That is on me. Or it is also possible that the data itself is wrong, just like surgisophier hydroxychloroquine, and that is on that person as well. So, meaning this is still an error prone thing, but at least you have a reference to go to and look at. So I'm happy about that, Reynald. Thank you very much for the appreciation. So Michelle says, then wouldn't there also be affinity maturation towards Lyme disease, yet Lyme patients do not seem to refine their response to Borrelia bacteria? And maybe they actually are refining their response, and somehow they're not able to get rid of it. And because of their response becoming more specific and specific, they're still bothered, and they just keep causing inflammation and still are not able to take care of it. Because in the affinity maturation, what happens is cells learn to bind better with the antigen. They don't learn to kill it better, they learn to bind it better. We feel that when they learn to bind it better, they are in a better shape to try to kill it. But now imagine in a thing like Lyme, where trying to kill it is not an easy task for our immune system. France says cool beans. Yes, I love cool beans as well. I always get so proud of the cool beans that whenever some guest is with us, cool beans, I always feel, are at the same level as the guest, and they are discussing with a similar knowledge and information, instead of just totally being outclassed by somebody speaking medicine. So I'm really, really proud of this. Sepal Steve says 442 watching, only 129 likes. Come on, guys, hit like. Um, so let's see. Doug says virus or only viral RNA shed from gut. So normally virus cannot escape and run around. What happens is our cells will pick it up. So the most irresponsible friend cell is neutrophil. It will pick it up. It is part of innate arm. Pick it up, chop it up, and throw those pieces out. So now there are pieces of the virus running around in the lymph node, and they would enter the lymph, and they would enter the lymph node. Then the macrophages and dendritic cell that pick up the virus and chop it up, they would actually run, some of them, to the lymph node, like going to the police station and say, look what I arrested, and then show it over there. So there are many, many mechanisms to bring the antigens to the lymph node and the cells there. Anubhav says, is it possible that someone takes a vaccine, gets the T cells, but still ends up getting COVID and being hospitalized? Yes. So if you saw with the Pfizer that they did this 6 months follow-up study in which there was one person who got declared COVID severe, who was vaccinated as well. That was 1% that they were following up out of 12,000. And I believe out of 12,000, maybe half of them were placebo, half of them were vaccinated. So out of 6,000 vaccinated, there was one who did become severe from one discussion. Paul says, Bean versus Campbell. Now there's an interview I'd like to see. You know that I don't do versus. Diversity Love says, I learned so much from you. Thank you very much. We did it together. I keep learning and watching and try to decide. Thank you very much. Thank you. Plant Kingdom says, I think Dr. B is some sort of saint. A person who just decided once I see that Stanford letter that I thought it is going to kill people. Unfortunately, what a tragedy that that is what made me do these talks for a year. But my own friend's brother died while following that letter. And I started talking, looking at that letter, thinking I should get ahead of it. This would cause people to die. And then since then, I've been doing these talks, and that was the tragedy. Passing time in Texas. I love your name, passing time in Texas. Question: harmful for someone with kidney disease to take ivermectin? She's already VACX with the Pfizer, but heading to Mexico. Would I do something that might help if she starts to feel some symptoms? So, can't give a straight specific advice. So, in theory, ivermectin is primarily metabolized by liver and excreted in feces. Less to do with kidney, more to do with liver, but still a dose adjustment may be needed. Carolyn says, no contest, Dr. Bean is the best. Thank you very much. Isn't this at the cool beans? We have become the best tribe. We are, I feel it, that we are the most educated and informed tribe. And do you know that today I am actually live on Twitch as well? So Bonk Bonk, who's a cool bean, he taught me how to do Twitch. And so today I'm live on Twitch as well. So Bonk Bonk, thank you very much. Sapel Steve says, have you discussed the role of IL-33 in SARS-CoV-2 infection? Just curious. No, I have not. So maybe this is something I should. Thank you for bringing it up. Let me write it down. IL-13. Yeah, so I'll be on Rumble. So Rumble story. Somebody had sent me a video of mine on Rumble, put up by somebody else. So, and this is a common thing. People take my videos and then they put them up. This is free. I even know folks who have taken the videos, a whole set down, and they sell it. And so it happens. But they had sent it to me. So I reached out to Rumble and I said, look, this person has taken my video and has posted it here. And they within 5 minutes responded and they said removed. And I went and it was removed. They asked me for the proof and I showed them the proof and then they removed it. So that was very interesting. Adish says, why don't you pick my question? I'm a cool bean too. Definitely. I do not know where the question is. Now I'm trying to see Adish's question. XY11 says, is there a limit human body can take number of vaccines? I guess there should be naturally some limit. Can't be thousands of vaccines in 5 years, just an example. No limit. No limit. Here is why. Think about it from the childhood till now. We every day get pathogens and fight with them. A pathogen is nothing more than a vaccine. It's nothing more than a foreign antigen that comes into our body and tells our body to fight it. Our body is very smart. It does not. So let's say I get cold with influenza and our body makes cells against it who fight it. Then when they have fought it and taken care of it, those cells would die. And then just some memory cells will be left for the future to make copies of and increase the number in the future if needed. So our body is very smart in this way that when we fight an infection or a vaccine, we don't keep fighting it forever like mad. We actually kill those cells off. This is why the antibodies go down after some time, because body says, fine, this is not there anymore. I don't need to continue to fight it. And so the B cells are killed, the T cells are killed that are responsible for this kind of a antigen. and some memory cells are kept. If that antigen comes back, then they wake up within 24 hours and increase in number and start um, attacking it. So please see this. If I share here, there are two terms that are very important for this answer and for all of us to know in general. One is proliferation. Proliferation of cells. Proliferation means increase in number. So our body would increase them when it needs them. So here, cell proliferation is the process that results in an increase in the number of cells. The other thing that we should know is differentiation. Differentiation is to become, for a cell to become more specific for a function. Just like a naive T cell can become T helper, cells can become differentiated into something. Just like when we humans grow up, we start becoming differentiated in various fields. So if you see here, if I know how to spell differentiate, cellular differentiation is a process in which cell changes from one cell type to another. So from a stem cell to a muscle cell, or so on. So our body can proliferate the cells and differentiate the cells to the kind of infection it needs to fight that day. Then it can take care of the cells and remove them. So give as many vaccines as you want. The side effect of the vaccine, the adjuvants, the metals, the other things that can bother us, that if you keep giving it, this is like if somebody is allergic and you keep giving them peanut butter or peanuts, they're going to die. So if we are reacting negatively and you just keep doing it, then that's not good. Art Patron Forever has a good question. So Fauci related question: will there be Munchausian vaccine addicts who keep coming back for vaccine fix to feel the excitement? Yes, there is an excitement. Uh, Lorene Kirby says question: so if vaccine after COVID infection doesn't boost immunity, what would be the benefit of getting the vaccine after recovering from COVID? So should I give a simple answer? Nothing. More maybe politically correct answer, or as I've been saying, our immune system is not bothered. If you take vaccine afterwards, think about it this way. When we have the infection and we have taken care of it, why do we need a booster? We will need a booster if our immune system has gone down pathologically, not physiologically. Physiologically, immune system going down will mean I got the infection today. I made 1,000,000 cells that would fight with it in next 2 weeks. They fought with it. They killed it. Now those 1,000,000 cells are sitting around. I don't want them around. So they would die. They would leave some memory cells. When the infection happens again, they would proliferate, increase in numbers, and then they would attack the infection agent once more, infectious agent once more. That is a normal behavior. So now, if I had the infection, vaccine, what boosting do I need? My body is already fine. Yes, if, let's say, I develop some way that my bone marrow got suppressed, or I was given some medicines that suppress the bone marrow or immune system, and now I have become vulnerable, then I need help. Or if, let's say, the virus has changed from SARS-CoV-2 to SARS-CoV-3 and it's a new virus now, then either I take a vaccine for the new virus or I get infected again. So otherwise, this is really not a big problem to take the vaccine. But I also don't want to stop someone from taking a vaccine. I repeat it every day that there have been long haulers who have said, after taking vaccine, I felt better. So maybe there is some benefit of it. But from a mechanism point of view, our body cares least. After taking care of, I was giving this example to my wife. She was asking me this yesterday. And I was saying that if you have a bucket of the infection, and that is the original infection, and our body took care of it, do you think it is going to care for a drop of infection coming from a syringe? It would not. James Crook says, why isn't anyone recommending something as simple as taking aspirin as protection against blood clotting? That's the point, James. If we just for once accept it, the most screams I heard at me from folks who watch me, some of them, not all, was when I said that AstraZeneca is doing it. And I was trying to say we should be ready and have, for example, for my wife, I'm doing these things now. Shouldn't we all be aware of it? So yes, you're correct. And the second is when I got vaccine, that is the second time when people were upset. But you are correct. Hey, Luffy. Luffy, where are you going? Come here. Come. Luffy, come here. Luffy, come here. Luffy is such a thing. He knows I'm trying to grab him. He just went over there and stood there. Okay, Susan Pick has a question. Let's see. Susan's question. So let's see. Adish says, do vaccine makers have technology to revert back harmful elements if vaccine fails in real world? No. Where is Susan's question? Susan, I'm scared. Susan, can you please type your question again? So Adish Shah, once again, the same question. They can't reverse it, but we can take care of, for example, if the clotting is happening, we can give blood thinners. Or if allergic reactions are happening, we can give EpiPens and steroids and take care of them in ICU. So this is how it would be. But there is no other technology and there is no other harm as well. Sky Native says, do you have any knowledge on blood type O resistance to C19? So very early on, about 8 months ago, we did a video called, I think the title was Blood Groups and COVID, something like that, in which we discussed it. The basic thing is that in the blood type O, the factor 8 is less genetically. And because it is less, then the thrombosis occurs less in these folks as well. They're prone to bleeding. And so in severe COVID, there is thrombosis, which is opposite of the bleeding. So because they are less prone to thrombosis, they are relatively more protected. Lena says, why in some people the COVID causes the cytokine storm? No, we do not know. So this is the strangest thing, that for the whole year, we haven't figured out. There are so many patterns that we can say this because of this, but it is not known why. Because if we knew which person could become severe, then we could ask them to be more protected. Susan Pick says, Dr. Bean, let's just look for the lips. Lol. Where? Lips. Okay, so if you're talking about lips emoji, I had blocked all messages that had certain emojis in them because there were some folks who were putting in lots of messages with those kind of emojis. So if you are talking about that, then maybe it is not showing up because it is kind of hidden. Adim Nepal says, look, Kairi is here as well. Hey, Kairi. Kairi. She does not even look at me. She's just going. Adim Nepal says, there were rumors that the memory B cells of SARS-CoV-2 only last for around 6 months. Is this true? No. The thing that we do not know is how long would they survive or live, because we have not lived with the infection for that long. Although now we know that there are studies that show that till 8 months we have the memory available. Previous researchers have shown that for SARS-CoV-1, the antibody protection, that means memory B cells, continued for 2 to 3 years. and T cell protection continued for 10 years. So I would hope a similar behavior with SARS-CoV-2 as well, but there is no study. Loretta says, time for me to go. Thank you very much. As always, thank you very much. Denise says, thank you, France. So J&J, so there's a question from Kelly. Is J&J vaccine safer for people with autoimmune diseases? So for all the vaccines, Pfizer or Moderna or J&J or AstraZeneca or others, they all said that we gave them to folks with autoimmune diseases as well, and it actually helps them. So I don't think that there is a problem with autoimmune. The problem is with allergic reactions. Those who have had severe allergic reactions or anaphylaxis in the past, they might react to these vaccines. That is what is in the data. Simple Meerkat, you are very correct. So Kyrie is just too independent. Denise says LMFAO. There is something going on. So here, okay. Yes, Jenna, Luffy does that. Kyrie just does not care. And Luffy does that. So when I got up this time, he went and stood there. When I moved towards him, he went and stood there. So that's what he does. Muhammad Zubair says, what happened to your hand? Nothing. This is my palm rejection. Although this hand has become swollen for about 2 weeks now because I developed tendinitis by drawing every day. But this I'm wearing for palm rejection when I draw. Doug says Susan pick an ARDS. So Susan, what is the question? Why can't I see that question? Luffy needs ivermectin. Yep. Susan, I'm going to be looking up for Susan's question. Here, I think here. Susan, Dr. Bean Medical Lectures. Hey, Kyrie. Oh, it is Luffy. Hey, Luffy. 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 He doesn't care. Dr. Bean Medical Lectures. Question at the point of, and here is Kyrie. What are they doing? They're going there, they're coming back, they're keeping an eye on me. Question at the point of a patient having ARDS and an on ECMO due to COVID, is it too late to have some Stromectal administered along with the other meds? I have one patient's case of this severity where ivermectin was given. They started improving but still died after 2 days. So I have seen that ivermectin still tries to help, but it does not become very successful. At least this is one case. So it is not even a study to say this is a generalizable thing. That means if it is possible to administer it, I will go ahead and do it. So for a doctor, somebody who's on ECMO, who's so severe, for them to wait for the patient and protect them from other drugs is not the right thing. They should just try whatever they can. So if I was the doctor, I would try ivermectin as well, and probably in a higher dose. Zia says, Dr. Bean, with the 91 to 92% effective coverage to getting the virus with ivermectin, according to the FLCCC's website, why do you feel that you need the vaccine? So, for example, I can only talk about myself, and everybody has to make their own decision. For me, it is actually, instead of just continuing to take ivermectin every week, and then continuing to think that if ivermectin, that, let's say 8%, if I'm in that, what would be the outcome? Will I become severe or not? Will I become hospitalized or not? Can it protect from death or not? So again, there is no drug that can guarantee protection or protection from death. Death can be death. But for me, a vaccine which is very specific against the SARS-CoV-2 is also another lever to help. So I'm still taking ivermectin. Actually, thank you very much. Today is my ivermectin due, so I would take it after this talk. So I'm taking ivermectin. I'm taking other prophylaxis as well. I am taking vaccine too. I am not fully sure that even vaccine can be 100%. So I can do whatever I can to protect myself. Even if after that I get sick, then I get sick. It's me says question, any data on vaccine risk for diabetes in heart patients? It's me. We actually talked about it a year ago. Of course, this is one of the diabetes is one of the top risk areas, especially uncontrolled diabetes. Heart disease itself is not a risk problem. The problem is that if COVID becomes severe and a person has a heart disease, they may not be able to sustain themselves under that stress when the acute respiratory distress syndrome type things, the severity of the blood vascular cardiovascular system damage occurs. So that is a basic problem. Cardiac problem directly does not have much issue. Many people say that, well, the heart has the ACE2 receptors and it can be damaged. Correct, but for the virus to reach the heart, it has to first damage lungs enough to be able to enter the blood vessels. Then it has to damage the blood vessels, it has to damage the heart. So the patient is already in a serious condition. The question is now, can the heart take care of the patient's blood needs, oxygen needs, plus can it sustain the viral attack? So that is a way to think about it. So Barbara Warren says, I totally agree. Vaccine is not 100%, and I'm concerned people are about to figure that out. Yes. So how about we break for today? And with your permission, if I can take, Margaret says, thank you, Dr. Bean. Patient is in Alberta, Canada. I'm sorry to hear that. I hope that they can get all the attention they can. So with your permission, if I can take tomorrow off. Zia says, thank you for answering my question. Blessings. Definitely my pleasure. And then Andrea says, Luffy is female or male? So Luffy is male and Kyrie is female. So there are more questions. So let me see if I can answer some more questions. JLB says, hi, Dr. Bean, 37-year woman that had light COVID and used ivermectin for first symptoms 5 days. After 2 weeks, is still a little tired and saturation is 94. This is a long hauler, no fever now. I don't know if we should call this a long hauler right away, but it is unusual. It has been seen that patients can actually recover in 29 days as well. But in my opinion, anybody who is not fully recovered should continue with the medications. And if I am the doctor treating someone like this, and if this was my patient, then I would have started with the steroids and other things too. But it really depends upon how their doctor is helping. There was another question from Nina Lord. Is it possible that thrombosis events are caused by ADE, increase in cases despite vaccination due to ADE? No. So here is why no. ADE, antibody-dependent enhancement, means the antibody. So let's say we have vaccine, SARS-CoV-2 vaccine, that produces antibodies against SARS-CoV-2 spike protein. Now, when the spike protein is received, then the complexes are formed, and then they would be able to get into the macrophages or other cells. Here we have a specific type of antibody produced that is different from spike protein, and that is antibody against the platelet factor 4. And so that cannot be ADE. Paul Borg says, take the entire weekend off, take care of yourself and your family. Thank you very much. I would take tomorrow and day after off, so we'll see each other on Monday. Uh, Art Patron Forever says older technology, iron lung, is gentler to body than intubation. You are correct that iron lungs compared to the intubation are gentler. The question only is the patency of the airway. You're correct that if there are iron lung, I would probably put the patient in that before the intubation. More questions. So sometimes first, sometimes last says some get more side effects taking the vaccine. Are these side effects related to one's immune response of some taking TH1 or possible? We don't know. This is the weird thing that we do not know why some people are doing the cytokine storm and others are not, why some people have more effects than not. For example, my symptoms have been lesser. Some tiny bit of soreness, and the next day a little bit of tiredness. Today very less tiredness, and that's it. I don't know now that the antibodies will be formed in another 2 3 days, and what happens after that I have no idea. So how are the people's body responding? We don't know. Arun Mehta says, what is the iron lung? So Arun, iron lung is a big chamber in which you put the person up to the neck, and that chamber takes the air pressure out and in and out and in, and that causes the chest to inflate and deflate and causes the breathing. Older technology, but it is not invasive like intubation, and this was correct that it could be better than intubation in this case. $22.22 says, did you get the test for antibodies before you got the vaccine to see if your COVID was a few weeks ago? So I did the test after I became sick, and I had done that rapid test and that was negative. I had done PCR and that was negative. I haven't done that yet. I have two more tests that Rima had sent me. So I am actually looking to do the test 2 to 3 weeks to see if I develop enough antibodies. So one for me and one for my wife. LEG says, do you feel cancer patients on active chemotherapy will have good protection after vaccination? They will have good protection after the vaccination. It also depends how much is the suppression, but they should take the vaccine. If, let's say, somebody is concerned, if I was the doctor, what I would do is this. I would ask them that after the second dose of the vaccine, let's say 7 days after or 14 days after, whatever is the protocol of the vaccine, then I would send my patient to get their antibody levels. Based on that, I would see if they need one more dose or if they have developed enough titer, or if they need to continue to be careful. So, Dr. Wadhwani, consulting physician, says no antibodies after 2 weeks of two doses. What next? Nothing. So, many of us respond predominantly with T cells. So, it doesn't matter if the antibodies are not there. A healthy person. Potato Chip says, question, is COVID-19 vaccine indicated among patients with myasthenia gravis? If it is, are there any side effects? So myasthenia gravis is an autoimmune disease. They have given in the trials the vaccine to people with autoimmune diseases without any issues. So even in the case of myasthenia gravis, there is a problem with the acetylcholine and the receptors, and the body is not responding that well to the muscles, but that does not exclude anyone from taking the vaccine. Colin Hamel says, I know hyperbaric chambers have been used in Zimbabwe. has ozone been tried out yet? So I had done one discussion here about ozone where there was a person from a cool bean from, I believe, Wisconsin, who had used um, ozone for his wife when she became sick with COVID and she recovered. So he was very, very happy about that. GCA says, please rest and take care of yourself and your family. You are so kind. Thank you for sharing your knowledge with us. Patient is safe for people with, is it safe for people with diabetes to get vaccine? Yes, they should actually get vaccine. It is safe. The uncontrolled diabetes immune system does not respond overwhelmingly or correctly. So the only loss could be that the person would not respond that strongly as needed because their immune system is low. So it would not cause allergic reactions unless they have allergies as well. So it should be fine. Ali G says, thank you for answering. It's really helpful for the cancer patients throughout the world. Absolutely. My pleasure. Saper Steve says, permission granted, Dr. Bean. Hope that your wife is doing better. Have a great weekend. Will do, and I'll update you. Thank you very much. Tony Clark question, if you get the J&J and that then get COVID, do you then have a greater immunity against COVID than you had with the initial shot? So the point of the vaccines is to provide immunity enough that the person is not hospitalized or does not die. They may still get some bothersome symptoms. They may still get some cold-like things or tiredness, but hopefully they would not become hospitalized and they would not die of COVID. So that is the point of these. Now, against COVID, then you had with the initial shot. You get it and then get COVID, you have it. So this is also true that once you have the vaccine and then you have the infection, with the infection, now you would actually get antibodies against more parts of the virus as well. So your cocktail of antibodies will go beyond the spike proteins. Marcelo says, taking a lot of vitamin C, D, and zinc have some effect in the production of antibodies when you take the vaccine. Yes, so they actually optimize the immune system. So it is actually good to keep your immune system optimized. Cool. So how about we break for today? And if this is okay, there is one more question from Adina. Uncontrolled grave disease, cytokine storm possibility from vaccine? No. So the thing is this is the important part. Autoimmune diseases are not automatically a license for cytokine storm. Actually, they are seeing that many normal people have more cytokine storms than autoimmune. So vaccine is fine and should be taken. It is actually protective. So you're very welcome. Good night to all the cool beans as well. So the website page to register the cool bean titles is still under development and we would have it soon. So thank you very much for your time. Thank you very much for being with me. And thank you very much for learning together and staying safe and happy and keeping people around you safe and happy as well. So please like, subscribe, and share. Minimum, if you don't want to subscribe or share, then like it. And at the same time, there are 3 links in the description. If you would like to buy me a coffee, there is a link to buy me a coffee. And then there is a link to be a patron. And then there is a link if you would just like to support this work. So thank you very much. Stay safe. Have a nice weekend. I'll see you on Monday. Bye-bye.